Jada was sexually abused by her grandfather. Noah was beaten within an inch of his life, and Maria and Michael huddled together as they witnessed the murder of their mother. These are just 4 of the 15,000 children reported abused or neglected last year in Mecklenburg County. 15,000. That's 5.5% of all kids under the age of 18, 1 in every 17 children in our schools, our churches, our neighborhoods. Child abuse is a public health crisis, yet our community's approach to addressing this epidemic has changed little in 100 years. We wait for children to suffer abuse before we intervene, and that response fails them. My name is Andrew Oliver, and I'm the Executive Director of Pat's Place Child Advocacy Center. Since 2005, we've coordinated the investigation and treatment of the most serious cases of child abuse in Mecklenburg County. Children visit Pat's Place to receive forensic interviews, medical care, and counseling. All the support they need to heal and move forward with their lives. Tonight, I want to talk about our plans to prevent child abuse before it happens. We need $20,000 to launch Project Safe Child, a community-wide child abuse prevention program that harnesses the proven power of location-based predictive analytics. Now, I realize that's a mouthful, so let me break it down. Our project starts by mapping the most common risk factors associated with child abuse. Things like domestic violence, community violence, and drug crimes. These maps will improve our understanding of how these factors contribute to child abuse locally. They'll also tell us where child abuse is likely to happen in the future. That's hard to imagine, but consider this. In Fort Worth, Texas, this model accurately predicted the locations of 98% of future cases of child abuse, down to the city block level. The model also predicted the likely locations of child abuse fatalities, infant sleep-related deaths, and accidental drownings. Knowledge is power, and when you know where something's likely to occur, you can do something to stop it. So here's the $20,000 question. What will we do to stop it? 2 things. First, we'll share our results with more than 20 local organizations that are already working to address the problems that contribute to child abuse. And second, we'll create Mecklenburg County's first child abuse prevention plan. Project Safe Child will help us coordinate resources across organizations to deliver the most effective prevention programs in the areas where children are most vulnerable. For 100 years, we've treated child abuse after the fact. And for tens of thousands of children like Jada, Noah, Maria, and Michael, our response came too late. It's time to chart a new course and do everything possible to keep our children safe. With Project Safe Child and your support, we will. Thank you.